Hello everyone, my name is Rachel Helt and my presentation will cover electronic health records. This presentation should be a great introduction into health information systems, which is what we will be discussing next week. During the presentation, we will be discussing what an EHR is, the history of EHRs, meaningful use, benefits of EHRs, some of the negatives of EHRs, consumers' views, the top EHR companies, and what the future holds for EHR. And then I have a few questions for you to discuss. To begin, an electronic health record is an electronic version of patient's medical history that is maintained by the provider over time and may include all of the key administrative clinical data relevant to that person's care under a particular provider. This includes demographics, progressive notes, problems, medications, vital signs, past medical history, immunizations, laboratory data, and radiology reports. An EHR automates access to information and has the potential to streamline the clinician's workflow. The EHR also has the ability to support other care-related activities directly or indirectly through various interfaces, including evidence-based decision support, that quality management, and outcomes reporting. Now we'll talk about the history of EHRs. The real history of electronic medical records began in the 1960s with the problem-oriented medical records. The problem-oriented medical record was a breakthrough in medical recording. Up until this time, doctors usually recorded only their diagnosis and the treatment they provided. This system was the first time that third-party facilities were able to independently verify the diagnosis. When properly implemented, this model provided a more effective means of communication among members of the healthcare team while facilitating the coordination of preventative care and maintenance. Then, in 1972, the first EMR system was developed, but this system failed to attract many physicians because of the high costs. And then in the 1980s, low-cost PCs gave way to the widespread adoption of EMRs. Large hospitals could now provide the same level of service for each patient without worrying about specific doctor-patient relationships. However, the technology didn't really gain traction with smaller facilities or private practices. The establishment of the internet made accessing health information online easier than ever, setting the stage for web-based EMRs. In 1991, the Institute of Medicine recommended that by the year 2000, every physician should be using computers to improve patient care. In 2004, President George W. Bush, at his State of the Union address, said that by computerizing health records, we can eliminate dangerous medical mistakes, reduce costs, and improve care. He outlined a plan to ensure that most Americans would have access to EHRs within the next 10 years. This finally came to life in 2009 when President Barack Obama signed the American Recovery and Reinvestment Act, which provides incentives for healthcare facilities who demonstrate meaningful use of electronic medical records. And we will discuss meaningful use in the next slide. So today, patient medical records are more accessible than ever before in theory, meaning that data technology is on the verge of becoming fully portable and comprehensive. Even with all the advancements in EHR's technology, only 70% of physicians are unhappy with their current system. Specialists especially have difficulty adapting to their EHR software due to their difficult needs and areas of focus. The next topic is very important to understand, and that is meaningful use. This is a government program that awards incentives for using certified electronic health records to improve patient care. Meaningful use is using certified electronic health records technology to improve quality, safety, efficiency, and reduce health disparities, engage patients and families, improve care coordination and population and public health, maintain privacy and security of patient information. And ultimately, it is hoped that meaningful use compliance will result in better clinical outcomes, improved population health outcomes, increased transparency and efficiency, empowered individuals, and more robust research data on health systems. Meaningful use was implemented in 3 stages that can be seen in the graphic at the bottom of the slide. Now we will discuss some of the benefits of EHRs. First, there is less paperwork and fewer storage issues. Because EHRs are paperless, they streamline the number of routine tasks. As the amount of paperwork decreases, the required storage space also declines. Second is the increased quality of care. EHRs provide the ability to exchange complete health information about a patient in real time. Accurate, up-to-date, and thorough information naturally leads to higher quality of care, from better diagnosis to reduced errors. Third is the financial incentives. Although the initial upfront costs are high, there are incentives to having these technologies. Through the Medicare EHR Incentive Program and the Medicaid EHR Incentive Program, eligible providers can earn incentives for the adoption and meaningful use of EHR technology. Fourth is the increased efficiency and productivity. EHRs can be more efficient than paper records by allowing centralized chart management and quicker access to patient information from anywhere with condition-specific queries. And finally, better patient care. EHRs allow for streamlined access to patients' complete records. This means no more filling out the same paperwork each time you go to a doctor or specialist office. Patients are less susceptible to duplicative tests or imaging procedures because the results and images are all in one place. Better coordination among providers leads to more accurate diagnosis, improved management of chronic conditions, and better overall patient care, which should always be the central focus of health provision. Along with the benefits of EHRs, there are also some negatives. First, there are the unexpected costs. Hospitals and health systems are often unaware of just how much EHR implementation will cost. All aspects of the implementation, from training to facilities to infrastructure costs, are mostly always underestimated. Next is physician dissatisfaction. When a new system is implemented, it is bound to lead to initial stumbling and glitches in day-to-day operations, causing frustration among physicians. That is why it is so important to educate physicians on the technology, along with how it can help them improve patient care. Next is workflow interruptions. According to a survey from the Healthcare Financial Management Association, 46% of organizations took between 1 and 2 years to resume normal workflow after an EHR was installed, and 11% took between 2 and 3 years. Next is vendor shortcomings. Vendor shortcomings have and will continue to prompt a non-negotiable number of providers to switch to a new system. About 1 in 6 providers will replace their EHR system in the next year. Finally, achieving meaningful use, but little else. According to a survey conducted by the Strahlenberg Consulting, found that more than 70% of the 211 IT professionals surveyed said that health systems or physician practices have successfully assessed to meaningful use stage 1, but it has not yet maximized the full potential of its EHR to improve care and workflow efficiencies. We have talked quite a bit about how EHRs fit into hospitals and larger health systems, but now it is important to look at the consumer's view of EHRs. The National Partnership data shows that consumer views of EHRs have increased over time. Now, 85 to 96% of all patients found EHRs useful in various aspects of care delivery, while only 57 to 68% saw paper records as useful. Patients also increased their access to EHRs by nearly 50%, surging from 26% in 2011 to 50% in 2014. Next, consumers want even more robust functionality and features of online access than are available today, including the ability to email providers, review treatment plans, doctor's notes and test results, schedule appointments, and submit medication refill requests. And even in the short time since this survey was taken, a lot of these things haven't been implemented, such as the ability to email providers. And finally, the patient's trust in the privacy and security of EHRs has increased since 2011, and patients with online access to their health information have a much higher level of trust in their doctor and medical staff than those with EHRs that do not include online access. There are over 500 electronic medical record companies to choose from. Each provides similar functionality but have their own pros and cons. Ultimately, the goal is for different health systems to connect and share records electronically so patient care can be managed at any facility. But because of heavy competition in the healthcare industry, this makes the next step very difficult. The top 5 most common EHR systems today are Epic, eClinicalWorks, Allscripts, Practice Fusion, and NextGen Healthcare. However, these rankings change depending on the size and practice of the organization. Finally, it is important to look at the future of EHRs. There are 5 main aspects that need to be improved for the future of EHRs. First is the simplicity and speed of documentation. It is important to decrease the burden of data entry for the clinician, noting that information entered by other care team members and patients should be as valued as information entered by the physician. Next, there should be a refocus of regulation. It is important to clarify and simplify certification procedures and meaningful use regulations. This will improve data exchange and interoperability, reduce the need for re-entering data, and prioritize patient outcomes over new functional measures. Third is to increase transparency and streamline certification. 4 is to foster innovation. EHR vendors should use APIs that will enable EHRs to become more open to innovators, researchers, and patients. And finally, support person-centered care delivery. It is important for the integration of EHRs into the full social context of care, moving beyond acute care and clinical settings to include all areas of home health, specialty care, labs, pharmacy, population health, long-term care, and physical and behavioral therapies. The problems we face today in EHRs use are complex, and solutions will not be simple or quick. Solving these problems will require regulatory stability, the development of an acceptable threshold barrier to entry into the EHR marketplace, and a supportive national policy. Now that you have a little bit of information about EHRs, I have 3 questions for you to discuss. First, what do you think is the biggest benefit to having access to your healthcare information? Second, have you used an online patient portal for your healthcare? Was your experience positive or negative? And finally, what are your biggest concerns with EHR? Thank you so much for taking the time to watch this video, and I hope you learned some valuable information about EHRs.